Imagine waking up every morning with stiff, achy joints that feel twice your age. It's more than just soreness, it's a struggle just to get your day started. For millions, this is the reality of living with inflammatory arthritis. It's a confusing term that covers the wide range of disorders, including rheumatoid arthritis, or RA, which is one of the most common types. But what exactly is inflammatory arthritis, and how does it differ from RA? Let's break it down, so you know exactly what to look for and how to move forward. What is inflammatory arthritis? Inflammatory arthritis isn't just one thing, it's an umbrella term that includes different types of arthritis where the body's immune system turns on itself. Imagine your body's immune system as a security guard. Usually, it knows exactly what's friend and what's foe. But with inflammatory arthritis, it gets confused, attacking your joints instead of protecting them. This leads to painful inflammation, swelling, and joint damage if it's left untreated. Types of inflammatory arthritis. There are several types of inflammatory arthritis, each with its own unique symptoms. Rheumatoid arthritis, RA primarily affects the small joints in your hands, wrists, and feet. Psoriatic arthritis, linked to psoriasis. This type often involves skin symptoms like rashes or scaly patches along with joint pain. Ankylosing spondylitis. This type targets your spine, causing pain and stiffness, especially in the lower back. But all of these types have one thing in common. They stem from an immune system that's mistakenly attacking the body's own tissues. Symptoms of inflammatory arthritis. The symptoms can vary depending on the type, but here are some of the most common ones you might experience. 1. Joint pain, swelling, and stiffness. These are often the first signs and can impact daily activities like walking or gripping objects. 2. Warmth and tenderness in joints. The affected areas may feel warm to the touch and be tender or sore. 3. Fatigue. Chronic fatigue is common, and it's not just tiredness. This type of fatigue can make you feel completely drained, even after a full night's sleep. 4. Nail and skin changes. Some types, like psoriatic arthritis, can cause nail pitting or separation from the nail bed. You may also see rashes or red patches on your skin. 5. Enthesitis and dactylitis. Enthesitis is inflammation where tendons or ligaments attach to bones, while dactylitis causes severe swelling of fingers or toes, making them look like sausages. 6. Eye inflammation and lower back pain. These symptoms are also common, especially with types like ankylosing spondylitis, which impacts the spine. If any of these symptoms sound familiar, it's worth talking to a healthcare professional. Knowing what symptoms to watch for is the first step in getting a diagnosis. Focusing on rheumatoid arthritis, RA. RA, in particular, is a chronic autoimmune condition. With RA, your immune system attacks the lining of your joints, the synovium. This lining helps to lubricate your joints, allowing for smooth movement. When it's under attack, you're left with painful, swollen joints that can become deformed over time if not managed properly. Symptoms of RA. Here's what you can expect if you're dealing with RA. Symmetrical joint pain and swelling. RA typically affects the same joints on both sides of the body, especially in the hands, wrists, and feet. The joints can become swollen, warm, and extremely tender to touch. Morning stiffness. Many people with RA experience stiffness that lasts for more than an hour after waking up. This is one of the hallmarks of RA. Fatigue and joint stiffness. Chronic fatigue is often accompanied by stiffness, which can make even simple tasks feel like a chore. Reduced range of motion. Over time, RA can limit your joint movement, making it difficult to complete daily activities. Rheumatoid nodules. Small lumps under the skin, especially near joints like elbows, can form. These are unique to RA. RA isn't just about joint pain, it can affect your entire body. Some may experience fever, weight loss, or a general sense of not feeling well. How doctors diagnose inflammatory arthritis and RA. If you suspect inflammatory arthritis, what can you expect at the doctor's office? Here's the process. 1. Medical history. Your doctor will want to know all about your symptoms, how long you've had them, and any family history of autoimmune diseases. 2. Physical examination. Expect a detailed examination. Your doctor will check your joints for signs of swelling, tenderness, warmth, and limited movement. They may also check for things like rheumatoid nodules. 3. Blood tests. Blood tests can reveal specific markers of inflammation. In RA, for instance, doctors might look for rheumatoid factor, RF, or anti-CCP antibodies. 4. Imaging tests. X-rays, ultrasounds, or MRIs can show the extent of joint damage or inflammation. This helps in forming an accurate diagnosis and deciding on a treatment plan. Treatment options. The goal of treatment is to control inflammation, reduce pain, and prevent further joint damage. Here's what treatment may involve. DMARDs, disease-modifying anti-rheumatic drugs. These drugs can slow down the disease progression and protect your joints. NSAIDs, non-steroidal anti-inflammatory drugs. These can reduce pain and swelling. Corticosteroids. These are often used for short-term relief during flare-ups but are usually not a long-term solution. Biologics. If traditional medications aren't effective, biologics target specific parts of the immune system to reduce inflammation. Physical therapy. Strengthening the muscles around your joints can improve mobility and reduce pain. Natural pain relief. Heat and ice packs, acupuncture, and massage therapy can provide additional relief. Surgery. In severe cases, where joints are severely damaged, joint replacement surgery might be an option. It's essential to work with your healthcare team to find the right combination of treatments that work best for you. When to talk to a doctor. If your symptoms persist for more than a few days or keep recurring, it's time to speak to a doctor. Pay attention to these signs. Daily life impact. If joint pain is affecting your ability to do daily activities like walking or holding objects, get it checked out. Recurring symptoms. Even if past symptoms resolved, recurring or worsening symptoms should not be ignored. Systemic symptoms. If you're experiencing symptoms beyond joint pain, like fatigue or unexplained weight loss, it's worth investigating further. Remember, early diagnosis and treatment can make a significant difference in managing inflammatory arthritis and RA. Conclusion. While inflammatory arthritis and RA are chronic conditions, advances in medical research mean more treatment options than ever before. Even though there's no cure, many people can live full, active lives with the proper care and management. Don't let inflammatory arthritis hold you back. The sooner you understand your condition and start treatment, the sooner you can regain control of your life. If you're experiencing symptoms, reach out to a healthcare provider and start the journey toward relief and improved well-being.